What's up, everybody? It's David. I'm your host of Highway to Health podcast. Thank you for being with us. If you know anything about this podcast, you know we celebrate the people and we celebrate the organizations that are committed to improving access, experience, and outcomes for our patient and our physician communities. And that's why I'm excited to bring our guest to you today. Really honored to have these two gentlemen on. They're doing something that I think you'll be interested in. I think you'll learn something from them. And I think they are committed as anybody that I've had on this podcast to improving the experience for our physician group. Lee Steinberg, Dr. Michael Sook, welcome to Highway to Health.
Thank you.
Thanks, David. Great to be here.
Man, I'm excited about this conversation. Now, I've been in healthcare the last 15 years or so, and I'm always inspired by some of the changes that are brought to healthcare from outside the industry, as long as those changes are brought to us with relevance, frame of context, and information within healthcare. And I think MD Envoy is a good example of that. I'm going to get into some of these things. I've got some questions prepared, obviously, but I like to start every podcast the same way. It's important for us to do our part for our own mental health, our physical well-being, so that we can perform for those that we love, but also those that depend on us in a professional setting. Dr. Sook, if I could start with you, could you share one healthy habit you've implemented to help you stay at the top of your game?
Yeah, thanks, David. It's really important to me to ensure that I get enough sleep so I'm rested the next day. But before I go to that final episode or the final moment, I spend a few minutes of taking the time to have gratitude for the day. I think that gives me to reflect and then allows me to sleep a little better.
I'm with you. Sleep over everything. Even Elon Musk says he gets 6 hours every day or every night. So if he can find a way, we can too. Mr. Steinberg?
Yes. I've been mind-boggled by some of the new breakthroughs in preventative health and wellness. So I prepare question 3 or 4 times a week. Candid, a thing called Bikini, which eliminates Sebastian, red light, and but cognitive neurofeedback, the RTMS.
The red light has taken over in my household too. It's become something that we've implemented, especially my wife and I. I appreciate you guys sharing that. I know it's important for others to hear. You guys are some of the busiest people around. It's important for our people to hear that if you can find a way to implement it into your routine, they can too. And we've got to do our part and maintain that responsibility. Before we get into some of the questions I prepared, Dr. Sook, give us an overview of MD Envoy. Give us like your 2-minute. If you were in the elevator with me today and you had to tell me about MD Envoy, tell me about it.
Sure, happy to. So MD Envoy is a concept that I think in a nutshell is built around the idea of providing agency for physicians, much like sports athletes and entertainers have in their industry. I think doctors do a wonderful job at the top of their game when it comes to clinical medicine. But it's an area where they need a lot of help. And so we're designed as to bring individual assistance to help these professional physicians achieve the best they can in their life on clinical medicine.
And you've done this for a while. You've mentored physicians for a long time, decades even. Give us an example of a mistake that you've seen physicians make, not because they're incapable, but just because they haven't had the support necessary.
Yeah, I think the most common mistake is optimizing for the first contract instead of optimizing for for the first decade. I think physicians are trained to diagnose risk in patients, but they're rarely trained to diagnose risks in systems. Misaligned incentives, vague productivity expectations, non-compete traps, and culture that look fine on paper, but also ultimately can punish you in life. I think docs spent more time worried about saying yes or brand or money, and then discover later that the job is designed for longevity. I think the tragedy is that doctors blame themselves when the structure was actually the problem. And so I would say in a nutshell is that people like it's a procedure when it's really a long-term.
And Lee, I mean, you transformed sports representation and you had to focus on stewardship over transactions. Where do you see the healthcare system treating these physicians, maybe like commodities or different kinds of resource instead of assets? Where do you see that?
I think listening to Dr. Suk and listening to the doctors that we've already enlisted in this program, you understand their frustration with bureaucracy. You understand their uh, intense focus on the work they have to do, which doesn't give them as much time to think about their own, about a holistic plan to uh, fulfill them. So it starts with listening and understanding what each physician's aspirations are, what his anxieties and fears are, and hopes and dreams. Once you have the ability to see the other person the way they see the world, will be able to take position and fulfill uh, long-term planning, do planning, uh, placement, negotiate them, financial them, and create a body of. So I think it's an exciting liberation, if you will, for DMs to be able to get closer to what their goal was.
Liberation is a great term. I mean, Dr. Sook, you're at AAOS. I can't go to a trade show nowadays. I just got back from Vive. I can't go to a healthcare trade show nowadays without the topic of burnout being really important. We're talking, we're looking for ways, and there are solutions all over the place trying to address this need, this issue of burnout for our physicians. Sometimes it is a personal issue, but oftentimes you might see burnout as a symptom of misalignment between the physician and the system, or the physician and the hospital. Tell me what you've seen there between physicians and employees, or physicians and employers, that might lead to burnout.
Yeah, burnout is oftentimes framed as resilience, but a lot of it is actually betrayed expectation, if you want to call it what it is. If I join an organization believing I'll have the autonomy, the team support, and the ability to achieve clinical excellence, and then suddenly I find myself in churn or understaffed or constantly negotiating for people resources, that's not personal weakness. That's misalignment. When values collide with incentives, people don't just get tired, they get cynical. And cynicism, and I think that's what we're ultimately calling burnout. And the burnout is frequently in the system when misalignment is actually the diagnosis.
I think that's really well put, because it's relatable.
Yeah.
Whatever profession we're in, whatever role we're in, if there's alignment there's hope, there's belief, there's a partnership. But when cynicism sets in, now it becomes oppositional.
Yeah.
And the trust breaks down. And if that hope deteriorates, so does our resilience.
That's right.
Lee, anything to add there?
Just that the collective strength of doctors working together with each other, as well as fulfilling their own needs, will be a great source of support. And anymore got an amazing support staff to help them work with them and to create a bonding the doctors and group. There'll be an extended training way, if you will.
Yeah, dig into that a little bit. I'd like to hear more about how, a service or a platform like MD Envoy, especially early clarity, can, if we're helping provide that up front, how it can prevent some issues that might cost not only the organization but the physician later. Talk about in more detail about that alignment and how that clarity can help solve some of these concerns.
Yeah, I'm happy to do that. Dave, you're hitting upon a really important question. When MD Envoy was envisioned and created, it wasn't designed to be the antithesis or an antagonist to employers. In fact, we see ourselves as a critical link to ensuring a longitudinal, stable workforce. Turnover is not just it's actually fundamentally destabilizing for healthcare. It breaks continuity, it drains call coverage, it brings up the physicians who stay, it erodes patient trust. People are here for a short time. So making sure that transparency and clarity at the front end in these conversations, it prevents what we call the silent failure. It shows up in 9 to 18 months later after somebody joins the job and says, "This isn't what I expected. This isn't what I wanted." Facing things like disengagement or access problems or recruitment costs. So what we're designed to do is to reduce that by getting the fit right up at the front end to kind of create a proper transparency around scope, expectations, support, values, and really the long-term pathway so the relationship is durable and not fragile. You have a great honeymoon period, and once that over, things if they're not settled up front, or at least there's not a clear understanding, those things can go on. Retention is the cheapest growth strategy in health and the hardest one to execute without the right alignment.
It, we saw a parallel between the early of how apps treated when all the power was in the hands of the phone, and they were told fungible or replaceable. Um, and in point of fact, they're not. I mean, you think about your life, and from the moment you're born till you leave the planet, doctors are critical factors every single day. And as we prioritize health, then we have to look at the mental and emotional health of this new group that's going to be served.
Before I got into healthcare, Lee, I actually coached small college basketball. And every year, obviously, with graduation and turnover, we had to go recruit new players and bring them in. And I was lucky to work for a really great head coach who taught me very early on. The most important recruiting job you can do is the players that you already have on campus. Because it's a multiplier. They get better the longer they're here. And we don't have to go recruit new ones to replace them if they're developing, if they're satisfied, if they're making the grades, if they're supported. And I learned early in my coaching career that retention was the most important job as an assistant. And I bet that's very similar to what you're finding here.
It is, because if you think about it, the best way to, quote, recruit is to treasure your current clients with attention, focus, and performance. And if they're delighted, happy, and fulfilled, they'll quite naturally talk to other people. Really, the most important thing in representation are listening skills. It's not treating these doctors generically as if they're cut out of a mold, but it's focused on each one's unique goals and aspirations. And when we talk values alignment, Michael and I are both believe that we're on this earth to make a positive difference and to improve and enhance conditions. And that money is an important value and will always maximize clients' compensation. But relationships and making a positive difference in the world is ultimately our purpose.
It's true in business and sports and healthcare. Your best if we are talking about staffing shortages across healthcare, the most expensive thing that we can do is to lose the talent that we already have. And building those relationships are that important. In business, keeping customers has the lowest cost of customer acquisition. And so there's a lesson to be learned here across any industry, across any walk of life that's being applied. And I've just never heard it talked about in this way when it came to physicians, which made this conversation that much more interesting and important.
Yeah, thanks, Dave. I think I would just add to that, our purpose when Lee and I first got together to discuss these ideas, the common purpose is, as he said, it's really to ensure that we have a stable workforce that we keep a critical aspect of the economy and kind of the social contract we have with people function in a way that preserves some autonomy and some sense of professionalism among the physicians who are doing it. And it's in many ways, there's so many parallels that Lee and I uncover as we look at his early start and doing what he's done for athletes across generations, and the approach and philosophy that he brings. And it's remarkably similar to be able to take the same approach and apply it to a totally different profession when the substrate is about the same.
And the domino effects to this just continue to go. I mean, obviously we've touched on the importance to the system, the health system. We can see it's intuitive to see how the physician experience improves. But let's talk about the patient. What have you seen in terms of patient, improvement to patient access, patient experience when, this process is followed?
I would just say, as a clear statement, I would say keeping one doctor in the right job matters much more than recruiting two in the wrong job, right? And that dovetails, I think, on our previous conversation around retention. It's access is not about how many doctors we train. It's about how many we keep in their sustainable roles, right? Every doctor who leaves a community triggers a cascade. Longer wait times, delayed diagnoses, more ED usage, worse chronic disease control, and especially in the high demand specialties, one departure, right? A neurosurgeon that's critical to an area can wipe out years of pipeline gains, right? So retention is population health, right? If we reduce the preventable turnover, patients get seen earlier, complications drop, and the underserved regions stop being the training ground that everyone's later abandons. So, I'm not saying that what we've created here is the solution to all of the woes in healthcare, but it's a recognizable problem. And I think we're taking a really first crack, meaningful step at trying to address it. And I appreciate your commentary about the fact that, maybe this seems like such an obvious solution, but Lee and I are really proud to be the ones to first take it to market.
Some of the best innovations are, the ones that may have been thought of but not been executed on because maybe they didn't have the expertise, the experience, the knowledge that MD Envoy brings. Lee, I'd like to, I'm a big sports fan. I think about, this physician experience similar to a professional athlete's experience. Oftentimes it means a new location, new city, all the things that, moving your family, finding schools for your kids, things like that. There are so many things outside of the care setting that the physician has to consider and plan for. You've done that forever, with these professional athletes. Tell me a little bit about your experience there and how that translates.
So basically, if you do the intake properly and you ask your client, whether it's an athlete or a physician, what's most important to him? Is it short-term economic gain? Is it long-term economic security? Is it geographical location? Is it spiritual values? Is it profile? Is it autonomy? Is it support staff? And you need to understand what each person's priorities are so you can build a long-term plan for them. We also need to listen to the other stakeholders in the medical milieu, so that it's important to understand what the concerns of a hospital or a HMO or insurance company or all the other people. And I think over time, they'll see MD Envoy as their ally in helping the overall health and welfare of doctors, keeping the retention rate high, and responding to needs. In life, I've got a new book coming out. I didn't do the negotiation myself. It's very hard at times to be the negotiator for your own self when the subject of it is your value and the rest of it. So we hope to be helpful in those situations in smoothing the path to fulfillment.
And this is becoming more and more important, as a member of this community in some way. I'm seeing physicians today are not just, caregivers. They're innovators. they're thought leaders, and even in some cases, they're content creators. They have their own personal brand. Um, how does MD Envoy help protect and develop that personal identity and presence and brand for these physicians?
Well, because we know everything about branding in sport. Just like Marketplace, we understand social media, we understand logos, we understand distinction. We also believe that we can help doctors who have aspirations to do a podcast, to be a television personality, to write a book. They're a rich source of content for movies and television. So there are all these ancillary areas where the doctor may be the newest person in biomed to come up with a breakthrough that revolutionizes the health system. And we'll help with that also. We'll help them build their new discoveries and their new research breakthroughs.
It's huge. And I'm sure that's just music to these physicians' ears, because their realm of influence is not just in the hospital anymore. It's everywhere. It's all the time now. Dr. Sook,
Yeah.
you've assembled, you both have assembled this Founders 100 of accomplished physicians. In healthcare, we know, like, nobody likes to be first. They'd rather be second. Let's get the kinks worked out. But you both have managed to assemble this Founders 100. What does that early involvement signal about, this unmet need or this transition?
The rapidity at how fast we were able to assemble what are some of the most accomplished physicians in the world to embark upon this kind of journey, with Lee and I, is really just a signal that even the most accomplished physicians feel that they have a source of need. They either feel underrepresented, underadvised, or have aspirations that they have an inability at this point to achieve because they don't have the time, they may not have the resources, and they just don't have the bandwidth to explore all the options. MD Envoy exists so that we can help facilitate that process. So we literally talk about hopes and dreams, as Lee talked about, and act as a way to help them fulfill those aspects. The one really important thing about the Founders 100 is it wasn't designed to be around being exclusive, but it was designed for us to understand how much it means as early proof that the current support structure for physicians is literally missing.
The exclusivity, I'm glad you addressed that, because there isn't just 100 of them out there that need this support. We see it all the time. They're so, they got into healthcare typically to deliver. It's not about them. They recognize that there's a community out there that needs them. And oftentimes that commitment, that obligation, that responsibility means that their personal needs and support takes a back seat. And so, yeah, I'm glad you addressed that, because it's not just a handful. There's a large community that's in need. As we wrap up here, let's look ahead. If MD Envoy succeeds, is successful over the next decade or so, what changes? What changes in the exam room? What changes in the operating room? What changes for patients? Give me your look ahead here.
For me, Dave, and I'm hoping it's not going to take 10 years, but in the examination room, I believe you're going to see more continuity. Patients with a physician who's actually present, not depleted, someone who stays long enough to build trust. I think in the OR, which is my area, you see more reliable teams, better scheduling stability, fewer staffing crises, and fewer workarounds that kind of creep in when the culture is stressed. For patients, I think it becomes simpler, right? We look at systems that can create faster access, fewer delays, less fragmentation, and better outcomes, because a clinician's career is now going to be designed around longevity, not just fixing the acute need. And the long game, I think, is a profession, and I talk about the profession as physicians, that feels sustainable again, because I worry that the last decade and a half of change that's occurred has really, as you pointed out earlier, has depleted our profession to the point where burnout is high. People feel less equipped in order to do what they want to do, and the profession has become more like a job.
When you support people who previously may work in a crowded place, but may, in terms of their own goals, feel isolated. When you start to surround them with a sense of support, not simply that the medical system is broken, but you start to focus on them, it will unleash a whole new level of energy and passion, where doctors can get back to why they initially entered the field, and they can get that initial sense of excitement back. And we replace burnout with support. We replace problems with solutions. And so I think it will have an energizing effect on the profession, and make doctors much more happy. And with that, a higher level of productivity, more receptivity to interaction with patients, and less time complaining and more time of being productive.
There's probably people listening to this that are wondering how they can be a part of it. Give them some direction here.
Yeah, thanks, Dave. I think we have a website that's up now. It's called www.mdenvoy.com. It provides all of the information you need about what we're doing, what we're trying to build. It gives an opportunity for people to reach out and have a conversation to see if we meet their life goals, desires, and that we can help.
Is more fulfilled in their role and in their position when they're able to do what they got in it to do. And somebody in this profession once told me, all of this awesome technology, all this great innovation is what we need, but nothing happens without the physician. Nothing happens without the caregiver. And sometimes we forget that. Sometimes we focus on, we don't keep the main thing the main thing. And without our physician community being supported, everything else can suffer. And so I'm honored. Thank you guys so much for being here. Congratulations on a solution that is commonsensical, but I know it's hard to implement, and it's something that's been needed for a long time. So thank you for bringing this type of innovation to our wonderful industry.
Thank you.
Thank you, David. Thanks for taking the time.